Good morning, students. Today, we will be discussing on the topic Surveyor. We'll have a short introduction on what is a surveyor. Then we'll see what are the different surveying tools, the different surveyors available. And we'll see about the different survey lines, the uses of a surveyor, and the different purposes of a surveyor. So, coming to the definition of a surveyor. Basically, it is a paralleling instrument. Dental surveyor is defined as a paralleling instrument used in the construction of a dental prosthesis to locate and delineate the contours and relative positions of abutment teeth and associated structures. This was introduced by A.J. Fortunati in 1918. Long back this was introduced, but still the same dental surveyors, the conventional model which was introduced back in 1918, are still in use in the field of dentistry. Newer advances have come up, but the conventional design is still in use. So basically, for the fabrication of a dental prosthesis, there are undercut regions, there will be prominent regions. So those regions which will aid in the insertion of the prosthesis needs to be identified and proper designing need to be done. So a dental surveyor will aid in all these procedures. This is the picture of a dental surveyor. The cast is placed on the cast holder for being surveyed. Now we'll see the different parts of the surveyor. As you can see in this diagrammatic representation of the dental surveyor, this vertical arm, this is the vertical arm. This horizontal part is the horizontal arm. This portion is known as the surveying arm. The surveying arm has the end which has the mandrel to which different surveying tools are attached. The end has a mandrel to which different surveying tools are attached. The cast to be surveyed is placed on this cast holder, which in turn is supported by a platform. Okay, so the different parts of a surveyor includes a vertical arm, a horizontal arm, surveying arm to which the mandrel is attached, onto which surveying tools can be used. Then you have the cast holder and the platform. These are the different types of surveyor. These are to name a few. There are many, 8 or 10 types of surveyors are available. These are the basic types. The basic types are Ney surveyor, Jellicoe surveyor, and the Williams surveyor. We'll see the peculiarity of each in detail. Coming to the Ney surveyor. Ney surveyor, the surveying arm, not the surveying arm, the horizontal arm is fixed. For the Jellicoe surveyor, the horizontal arm can swivel. There is a split in the horizontal arm for the Williams surveyor. The horizontal arm is split and joined. So basic differences in these surveyors are based on the differences in the horizontal arm. Okay. So this is the picture of a tooth with the surveying tool close to the prominent area of the tooth. This is the prominent portion. The widest diameter of the tooth is in this portion. That is known as the height of contour of a tooth. The area beneath the height of contour is the undercut. This is the retentive area. Okay, so for all the teeth in a cast, there will be a prominent portion, there will be undercuts. So these undercuts needs to be identified for placement of the retentive terminal of the clasp. Okay, So we'll see each in detail. So I wanted to show you how the surveying tools will pass along the surface of the tool. That is the representation here. So what are the different surveying tools? Different surveying tools are the analyzing rod, the carbon marker, wax knife, undercut gauges. We'll see for what purposes each surveying tool is used. The undercut gauges are of different measurements: 0.010, 0.020 and 0.030 inches. See, there are different measurements for the undercuts, right? So according to the depth of the undercut, you can use different gauges of the undercut gauges. So what is the analyzing rod used for? Analyzing rod is used to determine the relative parallelism of the surfaces. See, the first and foremost need for insertion of the prosthesis, for the successful insertion of the prosthesis, is the relative parallelism of the abutment teeth. We need to ensure that before fabrication of the prosthesis. If at all there is no parallelism, you need to achieve parallelism of the abutment teeth. Okay, so the analyzing rod will help in identifying the relative parallelism of the surfaces. Also, it is used to locate the height of contour. Then coming to the next surveying tool, that is the carbon marker. As you can see in this picture, the carbon marker attached to the mandrel is marking the prominent portion on this molar tooth, the height of contour. Okay, so it is used to scribe or draw survey line on the tooth surface of a cast. The survey line is the line produced on the cast by a surveyor to mark the greatest prominence of contour. Yeah, so the greatest prominence or the widest diameter of a tooth is the portion that will give you the survey line. Next is the undercut gauges, used to determine the amount and location of the undercut on the surface of an abutment tooth. As we already discussed this point, there are different measurements: 0.010 inch, 0.020 inch, and 0.030 inch. The significance lies in the point that if you have a severe undercut, okay, if you have a severe undercut, you cannot give a conventional clasp. You will have to modify the clasp material. The clasp, the retentive terminal will need to go through an entire deep area before coming out of the tooth surface. So there will be excess of stress and strain in the clasp. So the clasp material, if it is flexible, there will be less of force, unprecedented force onto the abutment teeth. Okay, so the undercut gauges will help in identifying the depth of the undercuts, and accordingly you can modify the clasp material if required. Next is the wax knife. This is used during blockout procedures. Okay, this carves the wax patterns of surveyed restorations also. So as you can see in this picture, the wax added is being trimmed by this wax knife. The excess wax will get trimmed using this wax knife. If at all this abutment tooth was intended to go for a crown, then the wax pattern can be inserted and then a wax knife can be attached to the mandrel and surveying done to identify if there is any bulky areas or any overhangings can be identified and can be trimmed before casting. Okay, so we have completed with the purposes of different surveying tools. Now we'll see what is the purposes of a surveyor. Surveyor is used for surveying the diagnostic cast. That is one among the purpose of a surveyor. Next is tripoding. Then the other purpose is surveying the master cast. Then as we saw on the previous slide, it is used to contour wax patterns. Contouring of crowns can also be done. So if at all we have fabricated the prosthesis, when the prosthesis comes from the lab, the cast can be attached to the surveyor and see whether any overhangings are there. So contouring of the crowns can also be done. Then for placement of internal attachments and for placement of internal rests. So coming to the first point, surveying the diagnostic cast. So before designing the cast partial denture, you need to identify the undercuts, interferences, relative parallelism. Okay, all these need to be identified. So surveying the diagnostic cast will aid in all these. So the cast will be tilted in a particular way to achieve a favorable path of insertion. So you need to replicate the same angulation in the master cast also during surveying. So replicating the same angulation onto the master cast, this procedure is known as tripoding. There are different methods by which tripoding can be done. I'm not going into the details of tripoding now. Just understand one thing. I'll give you one example. That is, if you have done surveying of a cast, you attach the cast holder to the surveying. You attach the cast to the cast holder and surveying was performed. During the surveying procedure, you understood that certain teeth need to be undercuts need to be engaged. So you tilted the cast to get a favorable undercut or to get a favorable path of insertion. Okay, so in order to get the same angulation for your master cast, what you do is the procedure known as tripoding. So the horizontal arm will get fixed and you move the surveying arm along the cast to mark 3 points on the palatal surface of the cast. Okay, so these points will aid in placing the master cast in the same angulation. Hope the point is clear. Then we'll see tripoding in detail in the next class. So these are the uses of a surveyor. To determine the path of insertion, to identify areas of guide planes, to locate and measure undercuts, identify areas of hard and soft tissue interferences, delineate the height of contour, and help in planning and designing of the removable partial denture. So we know how the surveyor will help in determining the path of insertion, right? And the next is to identify the areas of guide planes. So the abutment teeth relate by using the analyzing rod, you will find out the relative parallelism of the abutment teeth. From that itself, you can identify the areas of guide planes also. Okay, the parallel surfaces. Then measurement using undercut gauge, you can measure the undercuts. Hard and soft tissue interferences need to be identified well. Okay, if at all it needs to be removed surgically, it needs to be done before any other mouth preparations are done. Then locate and delineate the height of contour. And then ultimately it helps in planning and designing of the removable partial denture. So we have seen the point that it helps in locating and delineating the height of contour. So the carbon marker, as we saw in one picture, the carbon marker helped in marking the survey line. Okay, so we'll see what are the different survey lines seen in the tooth. What is a survey line? By definition, survey line is a line produced on a cast by a surveyor marking the greatest prominence of contour in relation to the planned path of placement of a restoration. We need to identify the greatest prominence of contour. Why? Beneath that will be the retentive area. So by identifying the prominence, we can indirectly get the undercut areas, or we can indirectly find out which retentive aid can be used for a particular condition. So according to Blatter-Fien, the survey lines are classified into 4. Okay, so the Blatter-Fien divided the tool surface into near zone and far zone. The area adjacent to the edentulous space is known as the near zone, and area far away from the edentulous space, the other side, is known as the far zone. So the different survey lines are medium survey line, high survey line, low survey line, and the diagonal survey line. So what is a medium survey line? We obtain any of these. Okay, we'll either get a medium survey line, we'll either get or a high or low survey line. So if at all it is not favorable, you got a high survey line or you get a medium survey line, but it will not aid in retention of your prosthesis. So what you do, you can tilt the cast into a certain degree and find out whether the survey line position have changed in order to give an ideal clasp. So the medium survey line, the line passes from the occlusal of the near zone to the middle third of the far zone. Then the diagonal survey line. Diagonal survey line passes from the occlusal third of the near zone to the cervical third of the far zone. Next is the high survey line. High survey line, it passes from occlusal third of the near zone to the occlusal third of the far zone. Next is a low survey line. It is similar to high survey line, but it happens in the cervical third. Cervical third of the near zone to the cervical third of the far zone. So according to the survey line obtained, the clasp can be decided. Whether a push type of retention or a pull type of retention needs to be given can be decided according to the survey line obtained on the cast. If at all if it is not favorable, you can tilt the cast to obtain a different survey line and modify the design of your RPD. So to conclude, the surveyor is an essential tool in the diagnosis and treatment planning of the removable partial denture. Once you have achieved the knowledge about the surveyor, the practical aspect is comparatively easy. You can perform the surveying of the cast, which will help in designing of your RPD in a very good way. If you have any doubts, please ask. This surveyor is an important question for your exam. Basically, you have to write first the definition, then you have to write the different parts of the surveyor. A diagrammatic representation of the surveyor would be impressive. Then you can write about the different surveying tools. What are the purposes of the surveying tools? Then you can write about the different surveyors available. Then again, you can explain what are the purposes of a surveyor, the uses of a surveyor. Then you can give the Blatter-Fien classification of survey lines. Okay, so these are the essential points in this topic. Please go through the topic, read well, and come for your next class. Thank you, students. Thank you.